94.7 FM Blair Radio, our nonprofit news brought to us by RVR Bank. Today we get to speak with Coartney with Memorial Community Hospital and Health System, and again, kind of helping everybody stay healthy as we continue on. Happy Heart Month.
Yes.
Make sure that you get in, see your primary care physicians, because it's an important month right there.
Mm-hmm.
So again, just a plug, contact the clinic and get scheduled right there.
Yep.
But also, it is February. So that means that the holiday stuff and everything like that, you had the Tree of Life going on. How did that go?
It went well. So we did kind of set a goal for around 30,000. We didn't quite get there, but we still made it up to about 23,000, which is still a win in my book.
Yeah, step in the right direction.
Yep. We are kind of wrapping that up. However, if anyone still feels like they want to donate or anything like that, we'll obviously accept that as we move forward.
Well, and interestingly, we were just talking before we went on air, is that you guys, the physical therapy, is for physical therapy, the new facility putting in. Updates and everything like that.
Yep.
But they have put together a list. So it's actually a $30,000 list of equipment to be able to help physical therapy, to be able to help those in our community and surrounding area be able to get through physical therapy a little bit easier and better, right?
Yes. Yep. So some of it is just updating old equipment that is currently there, and some of it will be brand new to the facility. So they kind of did their research to figure out what was needed, what could be used the most efficiently for us. And it was around $30,000 was what that total added up to.
And so if we, instead of having to pick and choose, if we find somebody who can get us over the top, then you can get all the equipment that they requested. Now, obviously, that's not going to be everything in the world, because we know when it comes to physical therapy or any type of therapy, that's just pennies on the dollar for the overall picture.
Right.
But it's just helping be able to provide those things coming up. So,
right. Yep.
Again, you can contact. Who do we contact if somebody wants to give?
That's me, Coartney DiGiorgio. You can always call me too. My number is 402-426-1464. You can mail in a donation if you'd like. You can drop it off at the front desk, whatever is easiest for you. But if anyone is still interested in donating, obviously we'll still accept donations at this time.
So, that's going on, but you guys also have more that you offer these community and be able to be a part of that. We're getting into the next month, and you do have a lunch and learn coming up this month.
Yes, next
is that
week.
like every month you do a lunch and learn?
Yep.
So again, just put it on your calendars now. So that way you can be able to go enjoy a free lunch and learn something.
Yep, it's not always on the same day every month. It's usually on the Tuesday or a Thursday, typically.
Yeah.
Just kind of depends on the presenter and what works for them. But this month, with heart health in mind, the American Heart Association is coming on February 20th to talk about Life's Essential 8, which are the key measures for improving and maintaining cardiovascular health. So that is a good one to attend. Like I said, it's February 20th from 12 to 1. We do have a registration link on Facebook so that we can just get a head count for lunch. Or again, you can call me to register if you can't find the link. But it's 426-1464 is my number. You can call and I can get you down.
And then you talk about there's so many factors into heart health that go into it. So everything, like this time of year, we're kind of in the winter doldrums. Everything's brown.
Yeah.
And so it's cold. You may not want to go outside. You may have stress. You may have depression. There's a lot of things that go in on how that affects your mental health.
Yes.
And that can then affect your heart health. Yep. And so, again, that must be, I would guess, the Life's Essential 8 is probably going to be able to cover a lot of these things that we see this time of year, isn't it?
Yes. For sure.
And so that, again, that's coming up the February 20th from noon to 1. And you register now, right?
Yep. Yep, register. This one is going to have a limited number of spots available just because of the room that we have to use.
Sure.
Because on top of the lunch and learn that day, it is also blood drive day.
Oh.
So the lunch and learn.
Here's some lunch, give some blood.
Yes. So yeah, we got double whammy on the 20th. So we got blood drive and lunch and learn. Blood drive will be downstairs in the Howard Severs conference rooms. We do still have some spots available there. So if you're available, please sign up. You can register through the app if you have it, or if you would like, I can get you registered as well. If you just give me a call and I can let you know what spots are available. We can't take walk-ins typically. It is...
Well, there's a lot in the process anymore.
Yeah.
You need to know who you're getting blood from and a lot of the background and everything like that. So, yeah.
Yeah. There is a bunch, I can't speak to this too much because I don't understand it all, but there are several Power Red spots available. If you are a Power Red donor, you would know it.
Yeah.
I know it's only certain blood types that can do it, but I don't quite understand what that means exactly. However, if you are a Power Red donor, there are several time slots available that day. If you could, that would be great to sign up to do that.
And then perhaps sign up to see if you can be a Power Red donor.
Yeah.
Because that's, again, obviously, that is specific blood types that are highly sought after, isn't it?
Yes.
So, again, and then the blood supply, the reason why you have to keep giving blood all the time is A, unfortunately, gets used, and B, it has limited time, doesn't it?
Yeah, and there's a severe shortage at this time, which is why they're pushing the blood drives quite a lot, which we do one every other month anyways. But yeah, anyone that's available, please sign up to come do that. And I know they're offering different incentives each month as well for people. It looks like this time around, you could get a $15 gift card. So there's always incentives like that to give. So if you're able, please sign up.
All right. So you can find, again, details by going to the hospital's website, MCHHS?
Yes, there should be on the calendar.
Okay. So you can be able to and then link through that way. But again, sign up now, and then that way you can be a part of that. So again, that day, it's a big day. It's all about heart health and giving blood. So you sign up for the lunch and learn, get some food, and then be able to give some. That helps out too when you have a full stomach, doesn't it?
I think it depends on the person, but yeah.
We'll just
Usually.
go with that. So that is coming up, and then you guys have you're starting to work on something also in the future. A little bit of tease here.
Yeah. So some exciting news because we haven't done this in quite some time. I'm not exactly sure how long, but we are planning to do a spring health fair.
Okay.
The plan right now is to do it on Saturday, April 12th, from 7 a.m. to 12 p.m. We are trying to focus heavily on screenings that day, so trying to offer as many free screenings as possible. It will be for all ages, so children as well. And so I don't have the flyer up yet. I don't have all the details yet. We're still just in the planning stages, but we will have a flyer going out. I will make a Facebook event as well to make sure I can include all the details. So if you're really trying to decide if there's anything there for you, please look for that Facebook event, and I'll try to include all the different screenings that will be available, the different community resources that will be there. If you have questions, you can talk to them. But yeah, so kind of mark your calendar for that. That'll be a great event. But again, still just in the planning stages, so I don't have all the details quite yet, but soon.
And then, so follow along on your social media.
Yes,
you guys'
for sure.
Facebook, Instagram, and all that stuff.
Yep.
Be able to learn more about that. So again, it is because we have a great hospital, great health system right here in Blair. It's providing for the surrounding area. You don't have to go into Omaha. You can just take care of everything in one place right here.
Yes. Yep.
So thank you guys for doing that. And we'll keep making sure people know, obviously, keep signing up for the blood drive and the lunch and learn, and then be ready for more that you guys are providing. So thank you for everything you do.
Yeah, thanks for having me.